4 children. I am now in my mid-40s. My metabolism is slow. I have so much stress. I have bills. I just lost my job. I have this going on. My husband and I are having marital issues. What does she know? Right? I can't listen to her. She looks like she's 20 years old. What does she know? I want you to silence those thoughts and hear me well. The quality of our life is dictated by our health. If you are depressed, if you have high blood pressure, if you have anxiety, if you are overweight, the quality of your health is not where it should be. Since we are talking about stepping into fruitfulness, how can we do that when we do not have a positive quality of life? A little bit about me. I am Dr. Vita. I was born Majita Mazivei. I live in Dallas, Texas in the US. I am married to an amazing husband. I have a wonderful son. I work at a medical center here in Dallas, and I have a laboratory where I work on lots of different cancer studies and other things. But my passion is working with women all over the world so that their quality of life can improve. Now for women, whenever we have issues with our quality of life, whenever we have health issues, we see that show up as infertility. So you have problems having a baby. You have problems with recurrent miscarriages. You have hormones that are all over the place. Okay, your menopause. When you go through menopause, you feel like you're going crazy. When you have menstrual cycles, your menstrual cycles are painful and you bleed heavily. And sometimes they go away and they don't come back. If you're suffering with any of that, endometriosis, PCOS, if you have cysts inside of your reproductive organs, there is a serious problem. And you have to pay attention to it. But menstrual cramps are normal. You're supposed to be moody on your period. You're supposed to have pain whenever you go through a menstrual period. You're supposed to bleed heavily. You're supposed to be miserable during your period. Have you been told that? If you have been told that, then I'm gonna ask you, who told you that you have to suffer? So if you're telling me that it's normal for a woman, it's okay for you to have menstrual cramps. God designed us as women every single month to have painful periods, painful menstrual cramps. Do you really think God brought you on this earth so that once every week for your reproductive years, you are miserable, you're in pain, you can't go to work, you're yelling at people, you're doing this, you're doing that? I had that. When I was in my 20s, I suffered from painful periods. The week before my cycle, very moody. If you come near me, I could punch you. Very, very moody. I would get cramps. I would get headaches. My body would just change. I would get bumps on my face. And I said, Lord, this is not what you designed me to do. I refuse to believe that you want me to live that life. I refuse to believe that. So I'm here to say, if you are suffering with your reproductive health, most of the time, what I have found is we can fix it. And a lot of times we can fix it naturally. So I have developed a virtual practice. I work with women all over the world, and we work to correct these health issues. So today I'm going to tell you a little bit about the process so that you, if you fit in this category in any way, you can begin to implement some of these things. Now, for the women that are going through menopause, you may think, I don't need to listen to her at all. What I have found, and I have a YouTube channel, it's called Dr. Vita Natural Health. I recently did an interview with one of my good friends. She's 60. She just turned 60, very good friend of mine. And she works with women that have undergone menopause. And we had a great discussion. You can go find that somewhere on my YouTube channel. And I have suffered. The women that are going through menopause or have gone through menopause suffer the most. Because at least reproductive women, you look forward to having a baby, or you have children that are young. But women that have undergone menopause, the number of depression rates that we see, women that have undergone menopause are miserable. We see issues with weight. All of a sudden, we start to see blood pressure. All of a sudden, we start to see cholesterol issues. We start to see diabetes. We start to see a lot of diseases. And then the depression kicks in because maybe your children are older, or maybe you never had children. So every woman under the sound of my voice, this is important. What I'm going to tell you for this next 30 minutes, please take notes. Please take notes. Men, I actually have a lot of followers that are men. And they always tell me, I'm so glad that you provide this information because I have a daughter. I have daughters. Or I'm a single father. I have to have these conversations. I have to know what's going on in my daughter's body. So if you're here and you're a man, now you may begin to kind of understand what goes on with your wife or what's going on with your wife right now. Okay. So I have a virtual practice where I help women get to the cause of their issues. So at the medical center where I work, I'm going to leave that medical center very, very soon as we're more financially stable enough for me to leave. You go into the doctor, okay, you have high blood pressure. Let me give you BP medication. Okay, you have fibroids. I'm gonna do an operation and remove the fibroids. That is how our society is. That's what we were trained in school. That's just what we do in medicine. You go to the doctor, they just give you medication. It's easy. We give you medication, we perform surgery on you, and then you're on your way. You just take your medication for the rest of your life. Imagine that. That taking medication every day for the rest of your life. Some of you are doing that and you think that that is okay. You have accepted that for the rest of your life, you are going to be on blood pressure medication. For the rest of your life, you're going to be on this particular pill. Okay. Have you asked yourself, why do I have blood pressure? Is it because because my mother had high blood pressure, I have high blood pressure? Is that why? Is it because you're stressed? Is it because you're overweight? Okay, if you're having fertility issues, I work a lot with women that are having fertility issues. Like I said, with women, whenever we have these serious health problems, they affect our reproductive system. So you start to see fibroids, lots of fibroids showing up, cysts showing up. She can't get pregnant, right? She's having painful periods. So it's important for us to get to the root cause of the problem. Do not just accept that I'm going to take medication for this for the rest of my life. Oh, because I don't have a medical degree, it's your body. I cannot tell you about your body. No one can tell you about your body. So I want people to take charge of their health. I say this all the time. You're going to hear me say it again. So now, let's say you have any of the conditions that I talked about. I wrote a book. It's called Women's Health Guide. It's a lot of people were coming to me and they were saying that they don't have time to work on their health. They don't even know how to research. They Google, they see misinformation. They just don't even know how to get to a point where they can be healthy, where they can have energy, where they can balance their hormones. So I wrote a quick, simple guide, and I'm going to tell you right here, I'm going to tell you some of the principles from that book. We don't have a lot of time to go through the whole thing, but I'm going to tell you some of the principles. Chapter 1, the introduction of my book, I have a quiz on there. And I'm not going to read the entire quiz, but I want you to listen to this yourself. If you have any of these, check them. I'm going to read a few of them. Do you experience any of the following? Irregular periods, painful periods, mood swings. This is anybody, even if you've undergone menopause already, right? I said irregular periods, painful periods, mood swings. Body aches and pains, miscarriages, low libido, joint pain, skin issues. What about bloating? Those are just some of the ones that are in here. If you experience any of those, I'm going to tell you what's causing them right now. Hormonal imbalances. It's all your hormones. So what are hormones? A little biology. I'm also a professor at a college. So a little biology lesson. Hormones are these things in our body that control everything. Okay, so they control chemical reactions in our body. So in order for me to be able to have a menstrual cycle every single month, hormones control that. So during the first couple days when I'm bleeding, a certain hormone is up. Then in the middle of a cycle, this hormone goes down, another hormone goes up. Then another one, it's a balance. A menstrual cycle is a balance of hormones going up and down. So any issue with that, any issue with any one of those hormones means problems with the period. Now, what about somebody who's overweight? If you have an eating problem, let's say you're just eating, you're craving foods, you're just eating and eating, that is a hormonal problem. So there is a hormone, a specific hormone that tells your brain that you're hungry. There's another hormone that tells your brain that you're full. So if you're always constantly eating, that hormone that tells your brain that you're full is off. It's not working, it's not functioning properly. You have a hormonal imbalance. What about the people that have digestive issues? You eat food and you're bloated, you have gas, you just have serious issues digesting your food? I'm sure you can guess correctly, hormones. But what about the face? You just have like pimples on your face think about it, when a woman is pregnant, doesn't she get pimples on her face? Why? Because of hormones. So when you have these health issues, a lot of times we can look at hormones. My question whenever somebody approaches me with a health issue is, I'm thinking what hormone is causing that. I don't think, let me figure out what medicine that person needs to take. I'm thinking, okay, she has 6 fibroids. So fibroids mean that there's excess estrogen. So there's so much estrogen, which is a hormone in her body, that they're feeding the tissues in her reproductive system and causing these big giant fibroids in her reproductive system. So essentially, I wrote a book on hormones. How it's called 5 Minutes a Day to Boost Energy, Balance Hormones, and Live a Better Life. So if we are able to balance our hormones, then we are able to boost energy, we're able to be the weight that we're supposed to be, and we can enjoy our life. So we're going to talk about stepping into fruitfulness spiritually later on, but how can we do that when we're in pain? How can we do that? How can a woman that has debilitating menstrual cramps live for God, serve God completely when a week out of every month she's miserable? How can you serve God properly when you are so overweight that you don't even love yourself? You're not managing the vessel that God gave you properly. How can you do what you need to do on earth if your body is not in order? And then there's some of you that try diets. Oh, you've tried this diet, you've tried that diet. You really, really tried, but at the end of the day, you just can't drop that weight. Hormone problem. It's your hormones. So for me, that's how I address every health situation. That is why I believe I am successful and I am able to work virtually. So I can order test kits for people away. I don't need to touch anybody. And I've been successful that way. That's why I'm leaving the medical center. I have been successful in virtually working with someone. Yes, if I need blood tests, I'll get it shipped to their house, blah, blah, blah. The point is, I don't need to touch you. I don't need to do surgery on you. For most, yes, there are some cases where people need surgery, and surgery is great. There are some cases where we need it. But I am telling you that I have success working with people virtually based off of the principles that I'm going to tell you today. Step number 1, food. Food influences our hormones. A lot of people eat foods that they're not supposed to be eating. Not because they're junk foods. Somebody could eat cashews and they're not supposed to be eating cashews. Everybody's different. So just because I can eat something and it's healthy, it's quote unquote healthy, that doesn't mean you can eat it. So number 1 is eating the proper foods. And then I'm not going to sit here and tell you eat healthy, because I'll be wasting my time. Everybody knows that they should eat healthy. I'm here to tell you that you have to figure out the foods that are right for your body. How? How is another thing. I don't have time. Okay, but the process is you need to figure out, when I eat this particular food, how do I feel? Do you ask yourself that?